Zaz has discovered the latest, instant surgery.
It used to be that if you wanted to correct minor foot problems like corns, calluses, and bunions, this was your only option. Hospital surgery, general anesthesia, casts, and up to 6 weeks recovery. But that was before minimal incision surgery. Podiatrists like Dr. Sheldon Nadal in Toronto are now doing in-office surgery that takes only a few hours, and afterwards you walk out on your own steam. Sound good? Well, Diane Arthur thought so too. After years of putting up with corns and hammer toes, she called Dr. Nadal to find out if she might be a candidate for the new technique. An examination showed she was, and she's coming in today for surgery before going to work. We asked Diane how much pain she's been putting up with.
It's constant. It's just a bother. It's just a bother. It gets in your way. If your foot hurts, you really don't feel like walking a long distance. You can't get shoes to fit properly. It stops you from doing things.
Dr. Nadal agrees. He says there are a lot more people out there with chronic foot pain than need to be. Using miniature tools, Dr. Nadal grinds away the bone growths that cause corns, bunions, and calluses. For Diane's hammer toes, he's going to cut ligaments to help her toes straighten out. We asked Diane what she expects the result of today's surgery will be.
Pain-free feet. It's going to be fantastic. I can hardly wait. I really can.
So you might ask, if it's such a terrific technique, why aren't more doctors using it?
The technique is not easy. Because it's done through very small openings, you have to visualize it with your mind, the structures that you're working on. And so the technique to learn is not that easy. And because so few podiatrists have been doing it over the years, there have not been many opportunities for other podiatrists or medical doctors to learn the techniques. However, the Academy of Ambulatory Foot Surgery in recent years has been sponsoring seminars to help disseminate the knowledge. And as more patients have it done, more people hear about it, and there's more interest in it. So I think eventually it will become fairly widespread.
And besides mastering a new type of surgery, Dr. Nadal has also been working on his chairside manner.
This sound here, and that's about the worst you're going to hear, other than, I sometimes scream.
The beauty of this new technique is that the incisions are only 1/8 to 1/4 inch long. This means there is very little damage to surrounding tissue, which means less pain. Most patients need only an aspirin after the operation. A local anesthetic is all that's needed, and that's much safer than general anesthesia. And according to Dr. Nadal, there are other benefits as well.
In addition to having very little pain, people are able to get back to work right away, or at least very quickly. And because of that, they can continue running their business or continue bringing home a paycheck.
And how did it all turn out? An hour later, Diane just put on her shoes, brushed herself off, and walked out on her own 2 feet.
Great.
We checked back 4 weeks later, and Diane says her feet feel like new, all thanks to minimal incision surgery.
There are many different foot problems that can be treated with walk-in, walk-out foot surgery. So if you're interested, check with your family doctor or podiatrist.